This is Dr. Ryan Bell with Yada Yada. Let's take a few minutes and talk about growing pains. So growing pains are extremely common. Age range is typically around 3 years, can be up to as much as 11 or 12 years. There tends to be a hereditary component to it. So if your child's complaining of aches and pains in their lower extremities, a lot of times mom or dad or other family members will know that, boy, I had really bad growing pains as a child, something that you expect to be hereditary. Classic growing pains are going to involve being more painful at night. So as night rolls around, kids have had a long day, they've been running, playing on their legs. That's the most common time you'll get complaints. Other hallmark characteristics of growing pains are that they come and go. It's not a real consistent thing. It should resolve during the daytime to the point that they're not limping and they don't seem to have any functional impairment, but are normal, active kids during the day typically, and then at nighttime tends to be when those complaints come. Things you can do to help with growing pains: massaging those legs tends to help. Heat packs are a good thing. Ibuprofen tends to work pretty well. And warm soaks in a bath or a hot tub tend to help relax those muscles. So those things should help. Times that you worry about growing pains is if they're atypical. So if you're having a lot of pain during the day, if it involves joints like the knees or the hips, giving them a lot of pain, it's probably worth doing a good evaluation. If you ever notice anything physically that seems unusual, like a lump that's there consistently on the bone or in the muscle, swelling with the joints, significant pain that you feel like is out of proportion to what you would expect with growing pains, any injury history where we're worried about fractures or dislocations, those would be factors that kind of put you outside of that normal. With growing pains, there usually isn't a need to do a big workup. X-rays generally aren't helpful if your child's clinical presentation fits the classic growing pains kind of a picture. We usually don't do X-rays, we usually don't have to do labs. So the diagnosis usually is just looking at the history, doing a good exam with the child, making sure things fit kind of that normal growing pains type of a picture. Growing pains are interesting. We really don't know exactly what's going on when kids have growing pains and why some kids are so much more prone to having those painful episodes. It tends to be the muscles that are stretching. So as the bones are growing, those muscles tend to stretch and pull and just can end up with a lot of pain. So work on those muscles, massaging, heat packs, warm soaks, ibuprofen. As long as it's coming and going on and off, locations moving around, then your child probably has a classic growing pains type of an issue, and just be reassured that they're going to outgrow that. Thank you. Have a great day.